Hi everyone. Today we are going to talk about communication difficulties in autism and how to communicate better with a child who has autism spectrum disorder. But before I dive into that, are you new to my channel? You are welcome. Make sure you are subscribed and have those notification bell turned on so you don't miss any of my videos. Now, let's jump into today's topic. Autism, also known as Autism Spectrum Disorder (ASD), is a neurological disorder that affects how a person perceives and interacts with the world. It is characterized by difficulties in social interaction, communication challenges, and repetitive behaviors and interests. Communication difficulties are a common characteristic of autism spectrum disorder. People with autism may experience challenges in verbal and nonverbal communication, understanding, and expressive emotions. Some specific communication difficulties associated with autism are: some individuals with autism may have a delay in developing spoken language or may not develop it at all. Others may have a large vocabulary but struggle with using language effectively. People with autism often have difficulty understanding and using nonverbal cues, such as facial expressions, gestures, and tone of voice. They may struggle with maintaining eye contact, taking turns in conversation, or understanding social norms. Individuals with autism may have difficulty understanding figurative language, sarcasm, or jokes. They often have a literal interpretation of language, which can lead to misunderstandings. Echolalia is the repetition of words or phrase spoken by others. Some individuals with autism may have echolalia as a way to communicate, but they may not fully understand the meaning behind the words they are repeating. Abstract concepts such as emotions or hypothetical situations can be challenging for individuals with autism to understand and express. Many individuals with autism have heightened or diminished sensitivity to sensory inputs, such as sounds, lights, or textures. These sensory issues can impact their ability to focus on and engage in communication. To communicate better with a child who has autism requires patience, understanding, and a flexible approach. And to help you communicate effectively, here are some tips. 1. Use clear and concise language. Keep your sentences simple and avoid using complex language or figures of speech. Be direct and specific in your communication. 2. Use visual aids. Many children with ASD are visual learners. Utilize visual support such as pictures, symbols, or visual schedules to help them understand and follow instructions. 3. Maintain a structured routine. Children with ASD often thrive in a structured environment. Establishing a predictable routine can help them feel more secure and understand what is expected of them. 4. Give them time to process information. Allow the child extra time to process and respond to your questions or instructions. Avoid rushing them or interrupting their thought process. 5. Use their interest to engage them. Incorporate their special interests into your communication to capture their attention and make the interaction more enjoyable for them. 6. Be mindful of sensory sensitivities. Many children with ASD have sensory sensitivities. Pay attention to their reaction to certain sounds, lights, or textures, and try to create a calm and comfortable environment for communication. 7. Use visual cues for emotions. Children with ASD may have difficulty understanding and expressing emotions. Use visual cues such as facial expressions or picture cards to help them identify and communicate their feelings. 8. Practice active listening. Show genuine interest in what the child is saying or expressing. Maintain eye contact, nod, and provide verbal or non-verbal cues to show that you are actively listening and understanding. 9. Be patient and flexible. Every child with ASD is unique, and what works for one may not work for another. Be patient, adapt your communication style, and be open to trying different strategies to find what works best for the child. I want you to always remember this. Effective communication with a child with ASD takes time and practice. It is important to approach each interaction with empathy, understanding, and a willingness to learn and adapt. Thank you for watching, and see you in my next video. Please don't forget to subscribe and press on the notification bell. Bye bye.